So let's start with this declaration itself, which I think is very significant. I think it's very important that the governor has declared racism a public health crisis. But as someone who works in public health, I imagine it lands on your ears a little differently. So tell us what your reaction was and is to this declaration.
Well, I was actually delighted to hear when the governor made the declaration about racism as a public health crisis, in part because we know that health disparities have been persistent, they've been profound for a very long time, and core to that are elements of inequities that are at a systemic and a policy level, which I can go into more detail shortly. But COVID-19 has actually exacerbated or illuminated the clarity that these health and healthcare disparities are very, very significant. So for those of us that are working in the field of addressing health and healthcare disparities for decades, this is not new to us, but that the governor actually took a stand to say that it's a crisis, which means it requires focused attention. She's at a level of urgency. It's so critical if we're going to truly close the gaps, because the gaps existed long before COVID, but it just shows her the intentionality that she has around closing these gaps and basically, realizing these gaps are not acceptable. And we have to identify ways to very systematically close the gaps, because the gaps have been created by systems and policies.
Yeah. Let's talk about some of the outcomes that you see from these inequities, the kinds of things that African Americans live with and endure because of the public health crisis of racism.
Well, Stephen, when I started my career some 30 plus years ago, we were not sure. Many of us that were, in the field of medicine, in the field of public health, we sensed that there were clearly disparities, but we didn't have the data, we didn't have the information. And about 2002, a landmark book came out called Unequal Treatment. And in that document, it clearly delineated that the disparities that we see are profound, they're persistent, and when we control for or account for socioeconomics, income, preference, insurance status, those disparities persisted. So it was very clear then that we had to approach this in a very different way in terms of closing these gaps. It wasn't typically the confounding of a socioeconomic condition or people's preferences, that it was clearly something that had to be approached in a very different way. So now, where we are now, it's very clear that we can do something much more substantive, and that's why the governor's effort is so key, because healthcare cannot fix these disparities that we've seen with COVID, these healthcare or health disparities that we see. It can't be fixed by healthcare alone. It's got to be fixed by multiple sectors of our community, and that's why by the governor establishing this council and calling it, a crisis, then she actually can rally multiple sectors to the table to systematically and very sustainably close the gaps that we see.
When we talk about implicit bias and the training that the governor wants all state employees to have, talk about the ways that that plays out in the public health arena.
Absolutely. So the element of implicit bias that we actually call unconscious bias, that's those biases, those stereotypical behaviors that people may, or stereotypical thinking that people may have that they're not even aware of. It's kind of blind spot thinking. They've been exposed to many negative portrayals of people of color, so they have a unconsciousness around that bias. But what happens is that leads to, and some even think, to sort of unconscious racism, where people are not aware that they're, perpetuating policies or practices that may disproportionately impact communities of color. And let me just give you an example related to COVID. And I must say, I'm so proud of the frontline workers, the first responders, the leadership, the health department. I mean, so many people have done fabulous work related to COVID. But yet there were things that happened that were that occurred that were not intentional at all. So, for instance, when we think about where the testing sites were, or individuals that didn't have a car, perhaps much of the initial testing you needed to have a vehicle, and so those biases, they were trying to keep people safe. So all the intentions were honorable. But yet you've got to look at things through a different lens, and you realize there were unconscious biases that went into play. You had to have a doctor's prescription, a car. Those sorts of things, a lot of people that were disproportionately adversely impacted did not have. So these are unconscious biases, but they lead to unconscious impacts that lead to, significant death in our communities, high case counts as well. So that's just an example where nobody intended to, great people, yet the outcomes were, devastating in some circumstances.
So talk about, from your perspective, the upside of the potential here. I'm one of the people who's always a little bit skeptical of committees and panels to solve big problems. But from your perspective, this declaration and the things that are happening as a result of it, what do you imagine could change, and could change maybe even in the near future?
Well, that's a great question, because I think what could change is that we begin to move upstream. So mind you, when we look at health and healthcare disparities, those are sort of downstream elements. You say, well, what has caused the health and healthcare disparities? Well, there's social determinants of health, which are jobs and education and housing and food and transportation. So that's what's caused those health disparities. So if you move a little further upstream, you see, well, what's caused those social determinants of health or social needs? Policies and practices. So what could happen is there could be changes in policies, changes in practice that actually would impact hiring, educational opportunities, housing opportunities, jobs, transportation, and then ultimately those downstream elements like health disparities or diabetes or COVID cases and deaths, then those could be the outcome related to those would be much more favorable. So you've got to move upstream, and that's what this declaration, the council that she's talking about establishing, has the opportunity to move upstream, not just look at those people that the cases of COVID, but you've got to look at why. When we think about it, housing, people could not socially distance because they did not have the housing capacity that others. And then you look at transportation, as I mentioned in the previous example. People need opportunity for jobs. I mean, jobs that can pay so they can afford housing and food. Opportunity to quality education. So we've got to move upstream, and government is one place because they can convene many key stakeholders to moving upstream and ultimately to policies and practices, because we are where we are because of policies and practices that were put in place many decades ago.